All right. Hello, everybody. Good morning. Dr. Rafich here from Vet Triage, October 19, 8:41 a.m. Pacific time. We are going through this issue of JAVMA. This is from January 15, 2016. And today we're going to hit up pathology in practice. So let's get into it. So this is a 23-year-old male Madagascar giant hognose snake. The scientific name for it is Heterodon madagascariensis from the family of Colubridae. It was found dead in its exhibit at the Columbus Zoo and Aquarium in Ohio, and they performed a necropsy. This is a cross-section of the snake's heart, and the asterisk is showing a soft tissue mass obliterating the trabecula of the heart, and it is located in the ventricular lumen. So in general, there's three reasons for soft tissue mass: abscess, granuloma, or cancer. And the ventricular lumen means the ventricle, which is a chamber in the heart. Lumen is the inside the actual chamber. And then trabecula are the muscles that are between the outer muscles of the heart and the chambers, and they look like kind of like almost like coral. And those are trabecula, and they help with contraction of the heart. So this thing was obviously invasive. They found on necropsy that the heart was enlarged. It was flaccid. There was clear yellow pericardial effusion. The cardiac ventricular wall was pale and thickened, and the mass obliterated the cardiac trabeculae. So pericardial effusion, the pericardial sac is a space between the heart and the pericardium, which is a sac that surrounds the heart. And that space normally has like very, very little fluid, at least in dogs and cats. So pericardial effusion means there's an excessive amount of fluid in the pericardial space. So then they said that on histology, they found spindle-shaped cells that were arranged in highly anastomosing cords. So spindle-shaped, we talked about this in previous live streams. There's two broad categories of cells, and that translates, of course, to two broad categories of cancer. There are those that are spindle-shaped, and they are under the category of mesenchymal. And then the other category is epithelial cells. Those are two very broad categories. And then underneath those two broad categories that come from the embryogenesis of the patient, you have different cancer types. Highly anastomosing cords mean that the cells are arranged in cords, but they all attach to each other. So that's anastomosing. These cords surround variably sized blood-filled spaces lined by flattened endothelial-like cells. Endothelial cells are the cells that line the blood vessels and lymphatics. This slide also stained positive for factor VIII related antigen as determined by immunohistochemical staining. So we mentioned in previous live streams, immunohistochemical staining is when the pathologist place a special stain on the slides, and it's supposed to be very specific for certain types of diseases that involve specific types of cells. And so when you have something that's a bit ambiguous, they place a stain on the slide, and that certain cells will uptake it. And then depending on the distribution of that stain uptake, you can determine what the diagnosis is. And sometimes it's multiple stains that are needed. So factor VIII related antigen is actually a coagulation factor. It's found in the coagulation profile to help with the platelet plug and forming a clot. It's found in the endothelial cells, and it's released when there's endothelial damage, meaning like you cut a blood vessel and you start bleeding. And so that's what this factor VIII related antigen is. So they diagnosed cardiac hemangiosarcoma in a snake. So let's talk about it. Hemangiosarcoma is a malignant neoplasm derived from transformed vascular endothelium. The primary sites of hemangiosarcoma in dogs are spleen, right atrium, lungs, and liver. If folks are interested, I should have the next week or so uploaded a video about hemoperitoneum, which does talk about splenic hemangiosarcoma. I have other videos on my channel as well if you're interested. In dogs, hemangiosarcoma is locally invasive, high rate of metastasis. The most common locations of metastases are lung and liver. The presence of endothelial cell markers like CD31 and factor VIII are commonly used to diagnose hemangiosarcoma. So CD31, CD means cell differentiation, and that's another specific stain. And then factor VIII we already talked about. Factor VIII related antigen has been used in bovine, so cows, canine, dogs, murine, rats, porcine, pigs, and avian species. Avian is birds. In snakes, it has not yet been documented in its use. So this is the first report of that. And for folks who are interested in what this looks like, this goes kind of above my knowledge base, but that's what the histopathology looks like for this snake heart, the mass. Okay. So the heart of reptiles, and reptiles are of the order Squamata, is composed of 3 chambers, 2 atria and 1 ventricle. So in humans, dogs, cats, there are 4 chambers, 2 atria, 2 ventricles. Atria is plural for atrium, and ventricles is plural for ventricle. And the snakes, they actually have a true like heart-shaped heart because they have 2 atria on top of the heart and then 1 ventricle at the bottom. They are divided by an incomplete septum. The single ventricle has 3 chambers inside of it, termed the cavum arteriosum, the cavum venosum, and the cavum pulmonale. Squamates, so snakes, also have sinus venosus, into which systemic deoxygenated blood collects and then drains into the right atrium. Oxygenated blood exits the heart through the aortic branches from the cavum venosum. Mixing of oxygenated and deoxygenated blood is minimized by several muscular ridges within the ventricle. So let's go over that again. The single ventricle on the bottom of the true atria has 3 chambers, and they're called the cavum arteriosum, cavum venosum, cavum pulmonale. And right away, you know by the names. Cavum arteriosum implies arterial. Cavum venosum implies venous. Cavum pulmonale implies lungs. And so these snakes have a sinus venosus, which is where deoxygenated blood, so blood that has no oxygen in it, collects and then drains into the right atrium. Oxygenated blood, so blood that has oxygen in it, exits the heart through the aortic branches from the cavum venosum. And the mixing of the 2 blood types, oxygenated and deoxygenated, is minimized by several ridges that are located within the ventricle. Clinical cardiac disease is uncommon in snakes. Usually they include congenital disease, nutritional disease, infection, or cancer. Cancer is somewhat frequent in reptiles with an overall prevalence of 9.8%, with snakes being the highest occurrence rate of reptiles at 15%. Among snakes, the reported prevalence of neoplasms was highest in the colubrids. Colubrids are the largest family of snakes, and they make up 21.8% prevalence of having cancer, followed by crotalids, which are rattlesnakes, copperheads, cottonmouths. They make up 15.9%. Vipers make up 12.7%. And finally, boids, which are like the anaconda, make up 8.6%. Typical mesenchymal neoplasms, so mesenchymal being spindle-shaped, in colubrid snakes, so that's the largest family of snakes, include chondrosarcoma, osteosarcoma, rhabdomyosarcoma, fibrosarcoma, leiomyosarcoma, lymphosarcoma, ocular sarcoma, hemangioma, and hemangiosarcoma. The hemangiosarcomas previously documented were located in the spleen, lung, skeletal muscle, and great vessels. One study found prevalences of hemangioma and hemangiosarcoma in any organ in snakes of 0.3 and 1.5% respectively. So 0.3% of snakes were found to have hemangioma of any organ, and 1.5% were found to have hemangiosarcoma of any organ. Reported cardiac tumors in snakes in general include rhabdomyosarcoma, sarcoma, and myelogenous leukemia. And I mentioned that rhabdomyosarcoma is the most common neoplasm. And that's the end of the study. I do have one problem with this study in terms of pericardial effusion. They didn't talk about what causes pericardial effusion or even address pericardial tamponade. So let's talk about that briefly, and then we'll end it. Pericardial effusion, like I mentioned, is fluid within the pericardial sac. It's most often caused by things like coagulopathy, so bleeding disorders, cancers, trauma can cause it. Toxicities can cause it. So a variety of different reasons for it. And if pericardial effusion turns into clinical signs, that's then called cardiac or pericardial tamponade. Tamponade means that the pressure of within the pericardial sac has exceeded to the point where the heart is now being affected by it. And so symptoms of that include things like tachycardia, weakened heartbeats, pale gums, weakness, collapse, syncope. So pericardial tamponade causes clinical signs. I would argue that probably in this snake, you can't really diagnose tamponade because the snake was dead at the time that they found the body and did the necropsy, obviously. But I'm going to assume that the snake had cardiac tamponade because it wouldn't have died if the heart wasn't being affected by it. And they didn't mention the second problem that I have with this report is they didn't mention any sites of metastasis, whether they found any or not. Hemangiosarcoma is highly metastatic, as we mentioned, in dogs especially. And so I'm curious to know whether or not there was metastatic disease because, the heart tumor may not have killed the snake. It could have been from metastasis or a combination. So anyway, otherwise, very interesting paper. The first reported snake cardiac hemangiosarcoma and the use of the fibrin of the factor VIII related antigen as an immunohistochemical stain. All right, we'll see you guys again tomorrow. Thanks so much for watching. Bye-bye. Bye.